You know, there are very few things in this world more terrifying for a parent or a caregiver than seeing a baby suddenly stop breathing, change color, or just go limp. It is a heart-stopping moment that has you scrambling for help instantly. But what happens after that initial panic? Today, we're going to walk through what doctors call a BRUE. We're going to break it down, make it clear, and hopefully make it a lot less scary. So let's dive in. Here's how we're going to tackle this. First, we'll talk about that terrifying moment itself. Then we'll get into what a BRUE actually is. After that, we'll look at how doctors try to find a cause and why your story is so important. We'll also unpack the difference between a low-risk and a high-risk event. And finally, we'll walk down the path to reassurance. It's really a journey from that initial fear to a place of understanding.
All right, Section 1, a terrifying moment. We have to start here, because to really get what this is all about, you have to start from the caregiver's perspective, from that raw, frightening experience of seeing one of these episodes happen right in front of your eyes.
And what's so powerful about this is that the official medical definition actually begins with your experience. It literally says, an episode that is frightening to the observer. Think about that. This isn't just some dry clinical term, it's a validation of the sheer panic a parent feels. The whole definition starts with you. So what does frightening look like in this case? Well, you might see apnea, which is just a medical way of saying a pause in breathing. Or it could be choking or gagging. You might see a color change, like the baby turning a bit bluish, which is called cyanosis, or really pale, which is pallor. Or you could see a big change in their muscle tone, where they suddenly go completely limp or really stiff. And here's the really tricky part. By the time you get to a doctor, the baby often looks perfectly fine. So you're left with a happy-looking kiddo and a completely terrified parent. So that brings us to Section 2. What is a BRUE? This is all about a change in name that was made for a very specific reason, to create a clearer understanding. And believe me, this wasn't just some small tweak in the medical dictionary. It was a really deliberate and important shift. And you can see that shift right here. The old term was ALTE, which stood for Apparent Life-Threatening Event. I mean, you can just feel the anxiety tripping off that phrase, right? The new term is BRUE, Brief Resolved Unexplained Event. And this change is huge. ALTE was not only worrying, it turned out to be inaccurate. It caused so much unnecessary fear because studies found there was no direct link to SIDS. BRUE, on the other hand, is way more precise. It tells you the event was brief, it's over, it's resolved, and for now, it's unexplained. It's designed to be way less alarming and much more accurate.
So let's look at the full official definition. A BRUE is an event in a baby younger than 1 year old where the caregiver reports a sudden, brief, and, I'm going to say it again, now resolved episode of one or more of those symptoms we talked about. The fact that the word resolved is baked right into the name, that is absolutely the key to understanding this. It's over.
Okay, so the event is over. The baby seems fine. What happens now? Well, this is Section 3, searching for a cause. This is where the medical detective work really kicks into gear. The goal is to figure out if there's an underlying reason for what just happened.
And here's how that search usually plays out. It's pretty much a 50-50 split. In about half of all cases, a specific cause is found. And if that happens, it's not called a BRUE anymore, it's just an explained event. But in the other half of cases, the event stays a medical mystery. It remains unexplained. And that's when it's officially classified as a BRUE.
So when they do find a cause, what are the usual suspects? Well, the most common one, by a long shot, found in up to a third of these babies, is gastrointestinal. Specifically something called GERD, which is basically a severe form of acid reflux that's really common in infants. Other possibilities could be neurological, like seizures, respiratory infections like whooping cough, or even heart-related issues. This is the checklist that doctors are working through in their minds.
This next part, honestly, I think this might be one of the most important takeaways from this whole thing. Section 4, Your Story is the Clue. The subtitle really says it all. A caregiver's account is the most important tool. You can't overstate how true that is.
Why? Well, because the baby is almost always perfectly healthy by the time they get to the doctor. So your account of what happened is everything. A clear timeline of symptoms from the person who saw it, from you, is the most critical piece of information they have. Your memory of the event, what you saw, what happened first, what happened next, guides the entire medical team. You are the expert witness. And to help get that clear picture, healthcare professionals will often use a simple little acronym to structure their questions. BIND. B is for birth history. Were they premature? I is for immunizations. Are they up to date? N is for nutrition. What and how are they eating? And D is for development. Are they hitting their milestones? It's just a really simple, effective way to get the full story.
Okay, so once the doctor has your story and has examined the baby, we come to a really crucial fork in the road. Section 5, low risk versus high risk. This decision right here is the pivotal step that guides absolutely everything that happens next.
So, the criteria for an infant to be considered low risk are super specific. The baby has to be older than 2 months, born after 32 weeks of pregnancy. It has to be the very first time this has happened. The event had to have lasted less than a minute. No CPR was needed from a professional, and the physical exam has to be totally normal. Now, here's the key. An infant is only considered low risk if they check every single one of those boxes. If even one isn't met, they're considered higher risk, and that changes the whole game plan.
And that decision leads us right into our final section, the path to reassurance. This is all about what happens after that evaluation. It's about management, observation, and most importantly, empowering you as the caregiver.
Now, for those babies who meet all the criteria for being low risk, the approach is actually wonderfully simple and reassuring. All the evidence shows that doing a ton of tests is usually not helpful and can even cause more problems. So instead, the standard of care is just a short period of observation, maybe with a monitor to check their oxygen levels. It's about watchful waiting, not invasive testing.
So, what does a safe trip home actually look like? Well, it's not just about walking out the door. It's about arming you with confidence. This means you should get clear advice on what to do if it happens again. You should be offered formal training in basic life support, or BLS, which can do wonders for reducing anxiety. A follow-up should be arranged with your local doctor. And most of all, you should get a clear explanation and real reassurance.
So let's just end on this thought. In a moment of pure fear, how can clear knowledge become a parent's greatest comfort? Well, it's because understanding the process, knowing the words, the steps, the logic behind the care, it transforms this terrifying, unknown event into something that's manageable and understood. And that knowledge, that is real power.